This is Reginald from New York. I do know him, Reggie Brown.
And have you been working?
This is my very first Ryan White conference. I'm so excited about it. I feel like I've been coming full circle. I was diagnosed as positive in 2013. And once I didn't know where to turn, I didn't want to be the stigma, so I moved to Philadelphia because I knew that they had the wraparound service. After receiving those tools and getting my HIV 101 certification, I moved back home. And now I'm an HIV navigator working for the Department of Health. Can you believe that?
We gather today with the united mission to improve the health outcomes for people living with HIV and to end the HIV epidemic.
It is events like this one that remind us that HRSA is not alone in our mission.
We know the front lines of the fight against HIV are not in Washington conference rooms. They're right where you work every day.
Conway, South Carolina.
Oakland, California.
Chicago.
Metro Atlanta.
I am from St. Louis, Missouri, home of the 314, the Show Me State. She had basically just told me I had tested for HIV, and I tested positive. It's not about me at this point. It's about hearing the story, using the facts, knowing the facts, and just being compassionate.
Thank you.
All right.
Tuesday night, I'm sitting in my bed, 11:30 at night, and I get this text message from somebody I don't know in Broward County and was like, hey, I know that we don't really know each other, but I know that you have HIV and I haven't told anybody yet. That's why I do it.
I remember every key person that has been a part of my journey. From the pharmacist that called me when I was on a substance abuse every night at 9 o'clock to take my medication, to my best friend, and I was getting out of the Salvation Army Treatment Center, who said that you can come live with me, to the people that walked me through my process of taking medication and getting to my doctor's appointment, to the people that challenged me to not die. See, my network challenged me to live.
This community is my lifeblood. I mean, it's the energy of why I'm continuing to do this work after 22 years. I do it because of the people. It's the relationships, it's the community.
The people living with HIV in Puerto Rico are in care. They are taken care of.
The mission of the Ryan White program and the clinics and programs it supports is clear. Connect Americans living with HIV to the treatment and support they need to live healthy, flourishing lives.
The Ryan White program ensures that people living with HIV have access to quality health care.
Ryan White definitely works. You can see that both in the data with viral load suppression, and you can also see that in the communities that are impacted. You know, people that are actually living full, long lives, happy lives, due directly to Ryan White.
When a person living with HIV walks in your doors, walks into our programs, into our services, they achieve 85.9% viral suppression.
In 2017, the Ryan White HIV/AIDS program served nearly 535,000 clients, a majority of them who were living with HIV. This represents over half of all the people diagnosed with HIV in this country, a mantra we live by and have. Data drives program and informs its direction.
I'm looking for a breakthrough cure, and I think we've come that far that it looks like one research that might break through for us to say, aha, you know, that we are there.
If we don't implement, in other words, pass the baton to people like yourselves to implement the science, we will never end the epidemic, and I do believe we will.
Well, I'm an optimist, so I do feel good about where we're going. I'm looking around, I'm seeing so many new, young faces. Makes me very hopeful.
I could have never thought in the past couple of years of my life that I would be at where I'm at. I went from stigma to success.
When I first tested positive HIV, I lived with HIV. So today, HIV lives with me because I'm in complete control.
I want to thank Ryan White's mother for all of her hard work over the many, 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 many years.
Thank you.